Hi everybody, this is Kelly with Rochester Woman Online, and today I am here with the fabulous Alicia Hicks.
Hi there.
We are here at Vitalize Medical Center, and I'm so excited because I am getting a little touch-up of Botox today and doing something totally different. It's called Thread Lift, and it is where Dr. Mulberry, who you're going to meet soon, is going to go in and get rid of some of these lines here and give my lips a little bit of a plump. So I'm going to let Alicia tell you too about Vitalize Medical Center and what they are doing here and what they're doing new, and you know, all of the different things that are going on now because of the COVID-19.
So we are finally opened. We've been open pretty much this whole time, but now we are open for aesthetic procedures. So we're back going with Botox, we're back with fillers, we're back with threads. Facials we're still a little bit out on. We're waiting to hear, you know, if that's something that we can open starting next week.
The fabulous Jessica Lar.
Yes, who is very eager to get back to work to see all your beautiful faces.
Me too.
Yes.
I'm anxious for her to get back.
So here at Vitalize, we are taking every precaution to keep our staff as well as our patients safe. Precautions include waiting in the car and then calling when you arrive. I will then instruct you when it's okay to come in. We will hand sanitize you you will hand sanitize yourself at the front. We'll check your temperature. There's a couple consents to fill out, as these procedures are elective procedures. So they are just some consents, letting you know that we are taking every precaution to keep you safe, but no matter how hard we try, there are sometimes, you know, unfortunately COVID, there's really not much known about it yet. It could be a long incubation period. So even though we disinfect thoroughly in between patients and we're masked and we're shielded, you know, sometimes, you know, like I said, you just have to sign the consent.
It's the price of beauty.
Exactly.
I'm willing to take a chance.
Right. And then you'll come back in the room with Dr. Mulberry or Jamie or Jason or whoever your injector is, and you could take your mask off, but we will remain masked at all times.
Obviously, that's why I have the mask off. If you can see, I've got a little shine right now because Dr. Mulberry has put on some of the Novocaine cream.
The lidocaine numbing jelly. That will just kind of help so that it makes it less uncomfortable. It's not god-awful to do these at all. They're quick, they're easy, they last longer than filler, and they really give that more natural-looking lip, which is what, you know, so many people want. Again, 12 to 18 months they last. This month, Vitalize is running a few specials. We are doing $50 off any one syringe of filler. And we also now have Restylane Kiss, which is the new filler from Galderma in the Restylane family. Very excited about that. And we have 25% off all waxing. So I know you guys have been quarantined for a while. You're bushy and you need to get your beauty on. So give us a call. We'll get you in. We are booking up fast. And we are very excited. Within the next few weeks, we're going to be launching laser hair removal, skin tightening, sunspot removal, all that kind of stuff too.
Ooh.
So we kind of got that right before COVID hit, and we had to put it on hold. So stay tuned for the next few weeks when we go and we start talking about that new device and get trained on it.
And stay tuned because we will be doing feeds all day today with Alicia and Dr. Mulberry, all morning, I should say, is they do the different procedures on me. So you guys can actually sit there and watch while it is being done, so you can know that it is not painful. It is, you know, it's quick, it's easy, and you get really great results. And I will be showcasing those results gradually as we go. So you'll see what I look like now. Then you'll see what I look like as soon as she is doing the procedures and when I'm done. And then we will chronicle it over the next 6 months.
Right, because unlike with filler, you do see a minimum immediate result with threads, but what's so great about them is they stimulate the collagen production underneath the skin to rejuvenate, regenerate itself, which is why you get that longer lasting. So it's something that keeps working even after it's in there.
And as Alicia knows, because I've been coming here for quite a while, I have a problem with the lip injections. So my body just for whatever reason, eats that up like crazy, and it'll last for just a little bit and then it's gone. So that's why we're here today to see about the threading and how that will have an effect with me and with my body system, because it's totally different. So I'm really excited, so stay tuned.
Hi, I'm Dr. Mulberry. Today we're going to be doing a couple procedures. One, we're going to be doing Botox to help get rid of some of the facial lines. And the second procedure we're going to do is going to do threads. We're going to do the small threads to help give a lip, which is going to help give definition and help turn the lip out a little bit because she has a smaller lip. And then as well, try to do some threads around this area to hope to smooth it out and to flatten it out, which also helps, lift up the lip as well. So
Yay.
We're going to get started. First, we're going to do our Botox. So as we just wipe her down with some alcohol first.
And I'll have you look up so you could see. Yeah, not really too bad. And then frown down. So we're going to go and concentrate on getting rid of, look up again, those wrinkles that you see over the eyebrows. And then when she frowns, those grumpy lines in between her eyes.
From squinting. And then,
oh, yes, her
as
crows.
you can see,
yeah, we're going to go first. We're going to do I'm going to have her scrunch down together. Okay, relax. Okay, I'm going to go this. Scrunch down again for me.
so Dr. Mulberry, tell everybody, how long does this take to kick in?
So Botox.
How long does it last?
Yeah,
All that good
Botox
stuff.
takes, for the max effect, you're going to say 7 to 10 days. You're going to start seeing some after a few days. You'll start feeling it. It's not going to be immediate effects, of course, because it's a toxin that, has to paralyze the muscles.
And how long does it typically last?
So Botox lasts only 3 months for paralyzing the muscle. However, over time when you're doing Botox, you're going to get effects that are a little bit longer, but the muscle will only stay paralyzed for 3 months. But the effects of it and getting rid of the lines, the more you do it, the less often you could possibly do it. Now I'm going to have you lift up your forehead so we can see those lines. And as we see, you're worse over here anyway.
Yep.
Let's stay up for me for this one then.
As you can see, though, it feels like just a tiny little prick. It's nothing.
Bruising should be minimal, if any at all.
Yeah, I didn't bruise at all last time with Dr. Mulberry.
That's only if sometimes you have a hidden vessel, you don't see it, but lift up that forehead. She tends to be right here on the outside for everything. Which you just have to be careful not to drop the eyebrow. Lift up again. With her, I just do little tiny bits because she really is not too bad. Yay. I know. Lift up your eyebrows again.
Again, showing, because Kelly's been pretty much getting Botox routinely here over the last several years, that those muscles begin to atrophy, so they really can't go into that position, which is what Dr. Mulberry was talking about when she says that the effects can last longer.
That's right. Because the last time, it took me, I think it was 9 months in between. Mm-hmm.
Okay, now smile really big.
So now we're going to get those crows.
Which are not bad on her, even though she thinks so.
Everybody's their own worst critic. We're like dancing here.
Yeah.
In our small rooms. I can't wait to be in our new space so that we have our bunch of new room. Perfect.
One little tiny bit left here. Smile again.
Use it all.
So how many units did you use, Dr. Mulberry?
40.
So typical for what we just did is anywhere between 30 to 40 units. The crows you know, if you're not doing the crows, you're looking more at like 30 units. Here at
Depends
Vital,
on age, really.
yeah.
Some age I'll have to do more. It depends on your facial expressions. It depends on a lot.
Right, and men tend to take more than women, but just to kind of give you an idea, because that's what we
interesting. I
get.
didn't know that.
Their muscles are stronger.
Ah.
So Botox here at Vitalize, as well as Dysport, is $12 per unit. And our Zeomin product is $10 per unit. All do the same thing. They're neurotoxins. They work to paralyze that muscle. Just some people have preference of one over the other. Now
Now we're going to start on the threads. It's a little bit different. I use the ChloraPrep prior to doing
We'll
this.
be
versus
coming
alcohol.
back to you in a couple minutes.
All right, so now we're going to start with the threads. Dr. Mulberry prepped Kelly.
Which we use a ChloraPrep.
Yep. And now we're just going to start putting the thread. That was number 1. How was that?
It feels literally
Actually,
like a little Botox prick.
What I'll do, also in your case right now, is leave all of them in. So we can show where all of them are. And then I'll pull them all out at the end.
Okay,
If you're okay with that. That's the other way of doing it anyway.
perfect.
A lot of people do that way because it's faster, because you don't have to take each one out.
Ah,
So this is what it looks like.
It's kind of hard to see the little blue thread that's on there, but
you can't see it at all. I'm standing right next to it.
I'll just keep all of them in this way, and this way we'll be able to.
And what you guys didn't see
Show.
was she cleaned my face, sterilized it, and then I touched my face, so she had to redo it.
That's okay. People do. Okay, so we're going to do left. Ready? 1, 2, 3, pull. I'm going to leave them in, though, as long as you're okay.
Yep.
So we'll see stuff, all the stuff sticking out. If any of them hurt, you tell me, and I'll take them out then.
Okay.
So bruising is minimal with this as well, just like with anything, but you do have to remember you are having a needle put in your face, so there is the possibility of some bruising, some swelling.
You're careful?
Mm-hmm.
Some of them might have to take out when we go around, but we'll go do all these around there, and you'll see how it looks. where I'm
Switch
going.
sides.
A lot less painful than getting filler.
As you can tell, she's sitting there with them in there. She's not bothered by them. Yeah, maybe I'll take all the bottoms out now. Just so we can look.
That's it? Okay, then.
And again, we use these for more than just the
I'll do a couple
lips.
more, just so I can get some. But you can already see her bottom lip has come down a little bit, so I'm gonna get some. I'll do a couple more.
Woohoo!
This is so exciting. It really,
Definitely like that.
and for people who are afraid of needles, like I'm one of those people that I don't like to look at it. I don't like to look at the needles. This is really easy and painless. If it just feels like a little teeny pinprick.
Yep, exactly. And I did to myself. I don't have a problem with it. And I hate filler in my lips. I'm gonna do this side, pull this one down more than the other one because the other one
Yep.
is.
So Dr. Mulberry, while you do that, what other areas, if you could tell everyone what you will treat? We've got the smaller threads, which is what we are using on Kelly right now.
Mm-hmm.
And then we have the larger barbed ones that will do more of that pulling.
Pulling up. So then the other ones, which we can do to pull up on the sides, to pull up, down here, here. You can do neck. You can do
Wow.
your knees. You can do your
Arms, belly.
What?
Yeah.
Okay, that's magnificent.
A lot of people want their knees done, you know?
I'm looking. The belly thing was like, whoa.
Okay, so let's do. Let me try to get some of this.
And the amount of threads that everybody needs, it's completely, variant. It depends. There's no way that I can, over the phone, or even Dr. Mulberry over the phone, can say how many threads you would need to achieve the look. It's basically kind of we go as we go until we get that aesthetically pleasing look. And, sometimes people start off on the lower amount of threads, and then they come back in a couple weeks and they get more.
You keep doing it too.
Until you're happy.
And again, these will last 12 to 18 months because they will continue to work to stimulate that collagen production. It's also a great alternative. I had a lot of people that call and say they don't like the idea of having a substance put in their lips, like a filler.
Mm-hmm.
That makes them kind of leery. And this really is not a substance at all. It's basically just a suture. So, right? Is that how you would describe it, Dr. Mo? It's like a suture?
It is, actually.
And it'll dissolve. So it's not...
And then the collagen
builds up.
builds
Right.
up.
The body heals over that suture.
Try not to reach back over to get another one.
I can't wait to have lips.
You can already see that Cupid's bow on that one side is getting more defined for her.
Yep. Definitely.
Oh. See, you guys can see everything. You guys are going to see stuff before I will.
Yeah. Well, because it's also, subtle, but you definitely, because I'm putting it into the lip itself.
Mm-hmm.
And actually, I'm going to pull this one out just to make it easier to get in for you.
My lips are still numb, so I can't.
Get
Oh.
some gauze.
Yeah, I have it in my hand. Really, you see, you don't have too much bleeding.
We would recommend that if you are on aspirin or Motrin or anything like that, to stop at least 5 days prior. Any type of Coumadin or Plavix, anything like that, we would want you to call us and let us know first. Dr. Mulberry, what are your thoughts, because everybody's protocol is a little bit different. If you have a history of cold sores, do you pre-medicate for your patients?
I would suggest, just because you're, anything irritating could do it, and taking it, isn't going to hurt you. So yes, I would.
So that's another thing to
That,
think about.
lysine and stuff like that can, be helpful. So I'm going to do more on the bottom lip.
So what we'll do is we'll cut it here, and then we'll get a picture of the final product at the end.
Perfect. I have a lip now. Yay! As you can see, I just had the threading done. I barely read where she injected the threads. Dr. Mulberry here at Vitalize Medical Center did the Botox, little crow's feet, little touch-up, and then we did the threads here and then on my lips. And you can already see, and I'll show people some of the photos before, and I'll take a couple after, but you can see that my lips have already, there's already a change. I can notice it. And over the next 3 months or so, it'll increase. But wow, what an amazing job they have done here. And I am so excited to see how it changes over the next 3 months. And it was quick. it took maybe 15 minutes, 20 minutes. And it was painless. I mean, it was little teeny pinpricks, nothing substantial. But I'm so excited. I can't wait to show everybody the end results. So come check out Vitalize Medical Center with Dr. Mulberry and Alicia Hicks.